Medication error is a major problem within the healthcare profession. It is, in fact, the most preventable cause of patient harm and results in patient illness and, not uncommonly, patient death. The medication use pathway involves doctors, pharmacists, and nurses, and good teamwork is essential. It can be difficult as a student to appreciate how much of your actual job will revolve around safe medication use, and how errors you make as a newly qualified healthcare professional will keep you awake at night. It can also be difficult to understand the interdependencies between a doctor, nurse, and pharmacist when prescribing, administering, and dispensing medication to a patient. Hear from some of our graduates who recently transitioned into the healthcare profession and now understand the impact of medication error and the need for teamwork in this area.
My name is Clara Heinrich, a newly qualified pharmacist working in community. My undergraduate studies provided me with the knowledge and the skill set to work in a safe and professional manner. However, it was not until I entered the pharmacy environment that I fully understood the extent of time that I would spend dealing with prescribing errors and medication safety issues, and consulting with doctors and nurses both in primary and secondary care. I found the learning curve steep. I wished I had the opportunity to interact with other healthcare professionals as a student to practice what I would actually be doing as a pharmacist in the community when I graduated from college.
My name is Stephanie Creed, a newly qualified doctor working in the hospital. Prescribing is one of the biggest challenges in intern year, or confidence in your prescribing, should I say. One personal experience I had with medication errors was to do with anticoagulation. I was on a very busy team. We had a patient who was admitted under our care for a number of weeks. While I was away from the team on a week and nights, the patient had a DVT and was started on therapeutic tinzaparin. The patient's weight was 82 kilos, which gives you a therapeutic dose of 14,500 units, which looks very similar to the prophylactic dose of 4,500. I subsequently discharged the patient without noticing the updated dose. Fortunately, the patient had a close follow-up and my error was spotted the following week. And most importantly, the patient was okay, but the mistake has stayed with me and changed my practice in that now I ask nursing colleagues to double check my discharge prescriptions before signing them. Most of my colleagues have had some form of prescribing error since we qualified, and most of the scenarios involve being busy or distracted at the time of the error. My advice would be to take your time, make sure it's the right patient cardex, right medication, dose and timing, and if you have any concerns, don't hesitate to discuss with pharmacy.
When I qualified as a nurse, I had some experience with medication management as I shadowed nurses during my internship, but I was not really prepared for how much would be required of me. There were so many drugs that were prescribed by brand and not generic name, doses varied amongst patients, many drugs were calculated by weight, and it took an immense amount of concentration under huge time pressure, which was difficult. I was lucky that I was supported by great colleagues. The longer qualified nurses and pharmacists were great to ask questions of, and some of the junior doctors and myself learned together. It always worked better when we worked as a team, so we could all admit that we were still learning and share the knowledge that we picked up along the way. We as nurses are in a tremendous position of responsibility when administering someone's medications, and it is a task that I have learned over time to respect and give 100% of my concentration to. There's too much at risk for the patient for us to do any less.
Remember, you are most likely to harm a patient when you qualify by prescribing, dispensing, or administering incorrect medications.